Hello, I'm Dr. Bailey. Vomiting is a topic that every parent deals with sometime in their child's life. We are going to discuss today the causes of vomiting, the signs and symptoms of vomiting, and of course the treatment of vomiting. First, what is vomiting? Vomiting is a forceful projection of stomach contents. This can be common, as again, this is something that every child will encounter sometime during their lives. The episodes of vomiting tend not to last very long and generally, again, resolve on their own. So you may ask, what causes vomiting? Well, there are many different things that can cause children to throw up, but rest assured, because the most common cause of vomiting is generally gastroenteritis, also known as the stomach flu. Gastroenteritis is a viral illness which can last up to 36 hours, but generally gets better within a day or two. In rarer cases, bacterial infections and parasites can also be the blame for gastroenteritis. But again, the duration is the same. The vomiting should still resolve in about a day or two. You may also notice that your child has other symptoms going along with the vomiting, including nausea or the feeling of wanting to throw up, diarrhea, and or stomach pain. Other causes of vomiting include food poisoning and motion sickness. Rarely, vomiting can be a sign of a serious problem. It is for this reason that we urge you to contact your local pediatrician's office or our office should the vomiting last longer than 36 hours. So what are some signs and symptoms of vomiting? Well, kids often feel sick to the stomach or have belly pain before throwing up. They may have other symptoms like fever, loss or decrease of appetite, and diarrhea or loose and runny stools. If the vomiting occurs frequently, then this can ultimately lead to dehydration from a significant loss of water from your child's body. Signs of dehydration include your child peeing less during the day, having no tears when they cry, having a dry mouth or cracked lips, dizziness or lightheadedness, acting very sleepy or spacey. So how do doctors find the causes of vomiting when they occur? Well, we can usually tell about the causes of vomiting based on your child's recent past medical history, and this includes what has recently happened with your child, how long they've had the symptoms, and any other associated symptoms that go along with the vomiting. Usually no tests are needed. However, if your child is very sick, we may need to order more thorough tests like urine tests or blood tests and or other tests to check for dehydration and to find out the true cause of the vomiting. How is vomiting treated? Treatment for vomiting depends on the cause. Vomiting from gastroenteritis usually goes away on its own in less than 24 hours. If your child has vomiting, preventing dehydration by giving an oral rehydration solution like Pedialyte or any store brand is essential. The formulas have the right amounts of water, sugar, and salt to help with your child's dehydration. However, you can buy this without a prescription at drugstores or supermarkets. If there is no way for you to buy oral rehydration solution, please call our office if you are a patient or talk to your local pediatrician. If your child only has mild dehydration and your doctor says it's okay to start treatment at home, then please start with small sips of the oral rehydration solution, which are about 1 to 2 teaspoons every few minutes. Babies can continue to breastfeed or take formula as long as they are not throwing up repeatedly. Please don't give babies plain water instead of oral rehydration solution. This is because it doesn't have the right nutrients for babies with dehydration. Older children can have frozen electrolyte popsicles, which I'm sure they're glad to hear. And please don't give medicines for vomiting unless we or your local pediatrician recommends that for vomiting. When your child does stop vomiting, you can offer small amounts of solid foods. Bland foods are okay, and you can progress rapidly if your child is craving food shortly after the illness has resolved. Kids who continue to vomit or have more severe dehydration need treatment in the ER or hospital. So finally, when should you call the doctor? Please call us or your local pediatrician if your child can't drink for several hours, has signs of dehydration such as peeing less often, crying with few or no tears, having a dry, cracked mouth and lips, feeling dizzy or lightheaded, acting very sleepy or less alert. If they have a high fever as well, a fever greater than 103 degrees Fahrenheit, if they're vomiting blood or has bright green or brownish vomit, has severe stomach or back pain if they're hunched over and crying, has a headache or stiff neck, is vomiting after a head injury, or is vomiting for more than 24 hours. These steps will ensure that your child is back to health in a short amount of time. As always, please feel free to call our office with any further questions if you are a patient or would like to become one. Find out more information at our website, www.askpeds.com. Take care, and we look forward to seeing you soon.